Another medical association is stepping away from consensus on gender transition treatment for minors. The American Society of Plastic Surgeons released a statement that it has not endorsed any organization's practice recommendations for the treatment of adolescents with gender dysphoria, and goes on to say that there is considerable uncertainty as to the long-term efficacy of surgical interventions. It goes on to say that existing evidence base is viewed as low quality and low certainty. Catholic ethicist Dr. Joseph Meany agrees and hopes other medical organizations follow suit.
Particularly with young people, that these irreversible changes should not be done to young persons who don't really understand the lifelong consequences. And so I think American medical societies are more and more going to realize this. I think also that they are going to be aware of the legal liability that doing this to children could come back in the form of lawsuits later on saying, wait a second, I did not have proper informed consent as to how life transforming this would be, and I regret that decision.
In a June declaration, the American College of Pediatricians officially called on all medical institutions to stop harmful gender transition medication and surgeries for minors, urging them to treat the mental health of those suffering with gender dysphoria.
Gender dysphoria is a diagnosis, whereas transgenderism is an ideology. The natural course of gender dysphoria is desistance by adulthood, conservatively in 85% of the cases, unless it is affirmed.
Doctors and medical professionals from more than 50 countries signed the Doctors Protecting Children Declaration. With more insight on this decision, we bring in now Dr. Scot Bradley Glasberg, president of the Plastic Surgery Foundation, which serves as the research arm of the American Society of Plastic Surgeons. Dr. Glasberg, thank you for being with us. Can you briefly...
Thank you for having me.
Absolutely. Can you briefly explain what in your research or data ultimately led the ASPS to this decision?
So as members of the multidisciplinary care team, plastic surgeons prioritize evidence-based medicine. So we have a responsibility to provide comprehensive patient education and maintain a robust and evidence-based informed consent process. And so currently the research on chest and genital surgeries for adolescents with gender dysphoria simply isn't strong enough to support any definitive recommendations from our society.
Did your group experience any kind of outside or inside political and social pressure to arrive to a particular decision?
So fortunately, plastic surgery is a specialty guided by evidence, and we're not influenced by external sources or by politics. And so the society's stance on the issue has remained consistent. We believe that more high-quality research in this rapidly evolving area of healthcare is what's needed, and our priority remains focused on patient safety and informed decision-making.
Something that jumped out at me, this decision cited this notion of, quote, considerable uncertainty associated with these interventions. Can you expand on that and explain what that means?
Sure. We believe that the level of evidence in these studies are of low quality. And what that means is every study has strengths and limitations that can tell us something interesting, but it's important to take a step back and look at the effects that we see and analyze the larger body of evidence that accumulates over time. We say there's uncertainty as to long-term efficacy for the use of certain surgical interventions for the treatment of adolescents with gender dysphoria. We mean that there's uncertainty at many different levels. We're unclear really what the outcomes data shows, what the long-term effects of these treatments might be or could be. And we feel a responsibility to remain committed to that evidence-based approach and seeing out the research necessary for the society to make any kind of firm recommendations or come up with any kind of guidance or guidelines documents.
You know, making a decision like this is a major statement for any organization. Is this a final decision, or is this final for now? Do you foresee your organization changing its stance in the future?
So ASPS is committed to doing the research and looking at further outcomes. We've set a lot of resources in this area to look at other research opportunities. By no means is this a closed decision, but right now the decision based on the evidence, that's been presented. If in the future the evidence changes one way or the other, we will analyze that and commit to coming up with whatever decisions are necessary, again, for patient safety, and base that on the clinical evidence available at that specific time.
Again, just in our final moments, this is a topic that is so often politicized and partisan, but it seems like you're saying this decision ultimately came down to the evidence.
Oh, there's no question. It's all about the evidence for us. Again, we're separate from politics. We're separate from outside forces. We are committed to being a scientific organization of surgeons who want to do right by our patients and want to provide the education necessary to our members to make the right choices that are in the best interest of our patients and that of patient safety. So with that, the evidence is the foundational support that is the key to making those decisions. And as a society, we have an extreme responsibility to maintain ourselves in that area.
Absolutely. Dr. Scot Bradley Glasberg of the Plastic Surgery Foundation, thank you.
Thank you so much for having me.